Hello friends, I'm Dr. Sharmila Thukral, consultant nephrologist at R.N. Tagore Hospital. So today we will be talking about pedal edema, the causes of edema, the symptoms and the treatment. Now, first of all, one should know what is edema. Edema is the swelling of a body part by either injury or inflammation. It can affect the whole body or it can affect a part of the body. It occurs when there is a swelling of the tissue due to leakage of fluid from the small blood vessels, which are called capillaries. Pedal edema per se, it means that there is swelling of the feet and ankles, which is caused by abnormal buildup of the fluid in the ankles, feet, or legs. Now, what are the causes of pedal edema? First is if one sits or stands for long periods of time, then the muscles are unable to pump the body fluids towards the heart when they are inactive. So this causes accumulation of fluid in the legs and it causes them to swell. Otherwise, it can be caused by many kinds of diseases. First of them being either infection or injury of the legs, feet, or ankles. It can be also caused by venous insufficiency, and the valves of the legs, when they are damaged in chronic venous insufficiency, they cause the blood to pool in the leg veins and it causes a swelling. In diseases of the liver, which is called liver cirrhosis, it is caused by various diseases like viral infections or alcohol consumption, and this causes accumulation of fluid in the abdominal area or it can cause in the whole body. In congestive heart failure, when there is chambers of the heart, they lose the capacity to effectively pump the blood. There is accumulation of fluid in the body, including lungs, which causes shortness of breath, especially on lying down. Then the very important cause of pedal edema is kidney disease, and fluid accumulates in the body, especially around the eyes and the face due to salt and water retention. Another important cause is inadequate drainage by the lymphatic system. The lymphatics drain the interstitial fluid, and when they are damaged by cancer surgery or radiotherapy or by the obstructed lymph nodes, then the drainage of the interstitial fluid that gets hampered and the fluid accumulates in the lower limbs. Now, severe and long-term protein deficiency can also lead to decrease in the oncotic pressure and causes edema. Now, coming to symptoms of edema, there is swelling of the limb, there is puffiness of the skin becomes shiny and stretched, and the skin also starts pitting and dimples on pressure. Now, how do you treat this disease? When the edema is mild, it goes away on its own, especially if the limbs are elevated. When it is severe, the doctor will prescribe some medicines called diuretics, which help in removing the water and the sodium from the body through the urine. The treatment of the underlying cause is the most important. Suppose the edema is due to a cardiac condition like defective valves or poor pumping action, you will be advised some medications or surgical options like valve replacement. Now, if there is a kidney disease and if it is advanced, one will have to go through a dialysis treatment or renal transplantation. If the patient is hypertensive, then one has to reduce the salt intake and it has to be less than 4 grams per day. There are many drugs which cause edema like steroids, non-steroidal antihypertensive drugs, estrogens, antihypertensives, and some antidiabetics. If one is taking these medications, they will have to be changed. There are few home medications and home measures for relief of just edema. They are like the movement of the limb. If the limbs are moving, they help in assisting the muscles push the blood backwards and the edema gets resolved. Elevation of the legs also helps. This pushes the fluid upwards towards the heart. Compression stockings can be used in various kinds of venous insufficiency, and it prevents the reaccumulation of fluid in the body. There can be one should also have a reduced salt intake if one is having edema. So One must take care and go to the doctor immediately if one notices these symptoms of swelling of the feet or ankles or anywhere on the face. It might indicate a severe underlying condition like a renal disease, a cardiac disease, or a venous insufficiency. Thank you, friends. Take care.